Hello, hello. It's Dr. Pam here. I am your virtual holistic pediatrician. I help moms raise healthy children naturally. So, if you are a mother of a young child or you would like to learn ways to treat your child's natural illness, rather your child's illnesses in a natural manner, this is the place for you. And if you have any friends who want to learn more information, once again, this is the place for you. This is what I do. I give information for parents, and I am now doing it online. So you can go online and get information from a holistic pediatrician. I have been practicing medicine for over 20 years. I have certification in homeopathy, and I've also been trained in bioenergetic medicine. So I do know a bit about natural medicine. I am also a four-time best-selling author, including a book on holistic treatment options for kids under five or five and under. So, um, if you're here right now, tell me where you are viewing from. And if you're looking at this later on, put replay in the comments so I can see them. I don't think, let me see, I can't see the comments right now. So I can go back. I'll go back to the comments later because later on I'm going to give you a chance to ask questions also. Now, once again, I am Dr. Pam Middleton, your virtual holistic pediatrician. I help moms raise healthy children naturally. So tonight, I want to talk to you about RSV, which stands for Respiratory Syncytial Virus. This is something that I've been seeing in the office, and it can be very dangerous for young children. Traditionally, it is something that would really only be dangerous for babies. But this year, everything seems to be different this year. So this year, I am seeing even, 1 year olds who are having extreme difficulty with this. So what are the symptoms? It looks like a cold. It's actually a virus. It can start off looking like a cold, like, your child may have runny nose, fever, cough, nasal congestion. But the thing that will set it apart and when you know that you need to seek help is if your child has any difficulty breathing. So if you have a child who has never had any respiratory problems, has never suffered from, does not have asthma, has never wheezed, but all of a sudden, they're wheezing, or they're really kind of struggling to breathe, you want to either get into your pediatrician right away, take your child to an urgent care or an ER. If your child is actually really struggling to breathe, you really want to get them into an ER right away. Okay? Now, what I like to do, I'm going to ask you to do something for me. And I'm going to come back to what I was talking about before, but I want to ask you guys to do me a favor before I forget about it. I'm going to be making some more videos, just really short videos on, frequently asked questions. And I already have some frequently asked questions that I'm planning on talking about, but I'm going to give you guys the opportunity to tell me things that you want to hear about. So if you can go on and put that in the chat, any topics that you would like to hear about, go on and put that in the chat, and I will be making some more videos on that. But getting back to RSV, yes, it can be very serious. I have had 1 year olds who have been hospitalized for this. So this is not something to take lightly. The only way to know if your child actually has RSV is to take them to their doctor and get a test done. Okay. But this is something that may start off just looking like a regular cold. But what happens with children, especially younger children, they can go downhill very fast. So your child may be looking like they have a cold, go to bed, wake up the next morning with difficulty breathing, grunting, something like that. You get them into an ER right away if that happens to your child. If your child is just exhibiting like cold symptoms and you're trying to figure out like, ooh, is this actually this RSV that Dr. Pam's talking about? Go on and take your child into their pediatrician and they can be tested. But RSV is it. We're seeing it across the country, and it can be bad for young children. Grown folks can have it too, but generally in grown folks, you're going to have a cold. It might be like a bad cold. I think it might actually be dangerous in elderly people this year too, but especially for children, you want to know if your child has RSV so that you can be on the watch for them suddenly getting worse. Okay. So remember, if you have a topic that you would like me to do a video about, please go on and put that in the chat for me. And let me see if I can even look at the chat right now so that I can answer any questions that anyone might have. Let me see the comments. Oh, and I am doing StreamYard, so I think you have to like allow me to see your comments. But even if you just go on and put your, if I don't see your question right now, I'll go back and answer the questions later. But remember, if you have a topic that you want me to talk about, please do drop that in the comments, okay? And so with that, I'm going to leave now and go look at the comments because I can't see any on here right now. So I'm going to go and see if there's any posted. And remember, if you view this later, go on and put replay and you can still go in and put down any topics that you would like me to talk about. Okay, so I am Dr. Pam Middleton, your virtual holistic pediatrician. I help moms raise healthy children naturally. Bye-bye.